So today's conversation is especially designed to leave you wherever you are as a business owner, human being with hope in the future that the very next action delivers right here, right now. Nadine, it's such a pleasure to have you. Welcome to the Daily Huddle. Good morning.
Thank you so much for having me here. I'm grateful and honored to be able to share this time with you guys in the morning. What a great group. Thank you for having me here. As they've introduced me as, I am an integrative addictions counselor and brain health specialist. And you wonder, where does that come from? I used to teach kindergarten and second grade for years, and then things evolved from there. But let me ask you guys, who here knows somebody who's been touched by any type of mental health issues, specifically the disease of addiction? I would think almost everybody either has a loved one or has a friend or knows someone struggling through that. And coming through the COVID-19 era here, there's something called COVID brain, and there's this COVID depression, and that disease actually that virus actually in some people expresses quite a bit of mental health issues afterwards. So this is a very real thing. You know, our epidemic right now is still COVID-19, but I'll tell you what, the next epidemic, if we're not in it already, is the mental health epidemic. And the statistics are off the charts with mental health. So, you know, my topic for today is, how do you know unless you look? And you're probably wondering, what on earth does that mean? Well, I can show you really quick. We can take a quick peek here. Can you guys see my PowerPoint? Okay. My keynote. Okay. So this is my son. He's a person in long-term recovery from opiate use disorder. That's the politically correct way to say he's a recovering heroin addict, okay? But we don't use that terminology anymore. We say a person in long-term recovery from opiate use disorder. We try and keep all mental health issues person-centered so that people feel less stigmatized, right? It's an expression of some more love and compassion towards the client, right? So my son, by the way, is doing amazing today. He's done well for several years, but this is the whole reason that I got into this whole wave of thinking. And so like he told you, I have a nonprofit called Hopedealers Worldwide. And what we did, I was a blooming entrepreneur in the area of, in the travel industry. And as I was becoming very successful as an entrepreneur, I found out that my son was struggling with an addiction. And I thought, oh, what can we do? What can we do to really, what can I do to really serve my son? Because none of my other kids had any issues like that whatsoever. They're all, you know, really great high achievers, and brought up my kids well. Why is this happening with one of my kids? Mental health is a respecter of no persons. It can hit the best of families, and it can hit all families. So I decided to take a group of people to Guatemala, the group of people who are struggling with the disease of addiction, to Guatemala to serve, to build a school in an underprivileged community there. And I thought, by getting them out of the country and immersing them in an active service, they could feel like heroes. They could feel self-worth again. They can, you know, they can have purpose again. And sure enough, 100% of anyone on that therapeutic recovery project is now clean and sober. They've been for over 4 years now. So that was quite some time ago. So real quickly here, we're gonna move on here. Let me push through this. So the next thing we discovered after that is, you know, how do we help keep people sober? How do we help them keep in long-term recovery? And that is by developing community. And A&E actually came out filmed us and saw how we kept the support group meetings going on. And that was the beginning of Hopedealers Worldwide, honestly. And then we decided, wow, these people are experiencing healing. They're getting much better. What can we do now to help the situation? And because a lot of them, a lot of people have felonies, a lot of, that were mental health related and or addiction related. And, when you become an addictions counselor, that's one of the professions that it's okay if you have a felony on your record, because the experience you bring to the table is absolutely next to none. So you get the education, you get the experience, and if somebody has gone through addiction successfully, they make some of the best counselors in the world. So I started teaching. Oh, there's a picture of my son now. He looks great. So that's a good thing. So let's move on to why the question, how do you know unless you look? And I'll go back to there. And forgive me, my slides are a little bit out of order here. There we go. There's our next pandemic, the mental health pandemic. One thing that we realized is, even though you're getting community together for people, and let me stop sharing the screen for a moment, even though you're getting people in community, even though you're getting them serving, even though they're getting some counseling and therapy, all the counseling and therapy in the world doesn't make a bit of difference if the brain is not functioning properly, if the brain is not balanced. So that's when we really started getting into the brain work that I learned through Dr. Daniel Amen with the Amen Clinic. You've probably seen him on PBS for the past 30 years. He is the one who's the author of The End of Mental Illness. But I decided to get my own brain scan to see if my own brain was balanced. And then I decided I need to do that for my son also, to find out what is really going on, because all the counseling in the world doesn't make a bit of difference if the brain is not working right. So family members, love their loved ones enough to understand that most psychiatric issues are really not mental health issues at all, but rather they are brain health issues that steal your mind. And if you can get the brain balanced and the brain right, the mind will follow. So brain trauma, it's a major cause of mental health issues, including addiction. But few psychiatrists know it because they rarely image the brain. And when a person gets their brain working right, their mind will follow. So just as a diabetic, manages their insulin, their pancreas can function right. Well, our brain is an organ just like our pancreas. And when we reimagine and reframe mental health as brain health, we decrease stigma, we increase compliance, and we increase compassion and forgiveness for family and loved ones. Now, I'm certain that many of those struggling with mental health issues ever received an accurate diagnosis. And they say 80% of people are misdiagnosed with their mental health issue. The most accurate diagnosis is achieved when a physician can actually look at the brain. So how can you know for sure exactly what's going on unless you look? And the specialized imaging that I like to refer my clients to is the SPECT imaging, where it tells how high the activity is in the brain, how low the activity is, and what is acting just right. So if you don't, and back in Abraham Lincoln's day, they diagnosed him with depression without looking at the brain. Psychiatrists are doing the same thing today. The more advanced psychiatrists are looking at the brain. So if you don't look at the brain, you're unnecessarily flying blind, which can hurt people we've been entrusted with to help. So looking at the brain changes everything for the better for our patients. And so let me just show you real quick what type of things we see when we look at the brain. So here is SPECT imaging of a normal view of the outside of the brain over there on the left and the inside of the brain on the right. The outside of the brain is going to show traumatic brain injury. It's going to show toxicity and some other things with the actual outside the structure of the brain where the activities happening. The right side pictures show the actual activity inside the brain. That would show depression, PTSD, anxiety. So here is an example. Okay, good. This is blanked out. So that was a normal picture. Here's an example of an addiction client. And you can see they had some football injuries on the sides of their brain. It looks like a chunk is taken out. It's not really a chunk is taken out, but there's no activity in the temporal lobe areas. You can also see on the bottom right picture, a lot of scalloping. That's toxicity on the brain. How do you know this stuff unless you look? If this person is ADD and a psychiatrist gives them Adderall, it's probably not going to serve them well because the temporal lobe issue, it looks like those chunks are taken out. It's just going to irritate them and make them more irritable. So as you can see here, there's some definite traumatic brain injury in the prefrontal cortex area, traumatic brain injury in the temporal lobes, and there is no medicine that cures this, but what we like to recommend is therapeutic doses of omega-3, and we like to recommend hyperbaric oxygen treatment, the same treatment that Justin Bieber and LeBron James, they all use this. The whole NFL football player team is contracted with Amen Clinics because they take a lot of hits in the head. So hyperbaric oxygen treatment does improve this. This is the inside of the brain. This is an addiction client right here. And I know it's a little hard to see, not in person here, but all those areas lit up white show way too much activity. And when you have a pattern looking like that, that actually shows PTSD. Have you ever wondered what PTSD looks like in the brain? That's what it looks like in the brain. Depression, anxiety, PTSD, and addiction is way lit up in the brain. So it's really interesting. How do you know this stuff as a psychiatrist unless you look? So more psychiatrists are coming on board with looking. And, I have this little poem here that I love to share. If you have crushing chest pain, your doctor will scan your heart. If you have crushing depression, no one will ever look at your brain. If you're sick to your stomach, your doctor will image your abdomen. But if you're sick with anxiety, no one will look at your brain. If you have stabbing back pain, the doctor will image your knees. But if you have persistent heartache, no one will ever look at your brain. If you have chronic cough, if you have tormenting hip, if you have a spouse that torments you so much that he or she leaves you, no one will ever look at your brain. If you're paralyzed for an accident, your doctor will scan your spine. If you develop runaway tachycardia, your doctor will scan your heart. But if your teenager runs away and lives down the street, no one will ever look at the brain. So how do you know unless you look? Psychiatrists are the only medical doctors that are not looking at the brain. I have a feeling because if they actually look at the brain and find the root of these issues, they might actually get people well, and then they might be out of business. just being real. So 80% of people that do walk in to have their brain scanned find out that 80% of people have been misdiagnosed. Schizophrenia, bipolar, Alzheimer's, 7 different types of ADHD, and 6 different types of addiction. How would you like if your loved one was told they had Alzheimer's, and then they went in and had their brain scanned and find out it was not Alzheimer's at all, but it could have been a form of depression called pseudodementia, right? So these are huge. Misdiagnosis is huge in the area of psychiatry. So I'm going to show you my own personal ones here to wrap this up, because we're probably coming close to the end of time here. And I don't know how well you can see this here, but over on the left, you'll see some traumatic brain injury, and definitely ADD was really bad. you'll look 20 months later, and I imagine now my brain is even doing much better now. You'll see all of that is completely healed by having my brain scanned, getting a proper diagnosis. A brain scan doesn't give the whole diagnosis, but it's just one piece of many pieces that give a diagnosis. So 20 months later, I have complete healing with traumatic brain injury. It's completely gone. I don't know if you could see the hole over on the left in the top of the brain, and that's completely covered up now. I have more peace than I've ever had. I wrote a book called Hopedealers, sharing my entire story that actually hit international bestseller on Amazon on launch date. Someone in Mexico went crazy and bought a bunch, which is cool. I was actually #1 and Michelle Obama was #2 on Amazon that day. So that was pretty cool. I could have never written a book before. So my own personal journey, my journey with my son, it has helped so much. So just to wrap it up here, there are some, oops. I also formed another nonprofit called Next Door for the community. So I've been able to do things that I never thought I could pull off before. But really the best thing to do in closing here is to reframe this whole mental illness thing. The end of mental illness begins with a revolution in brain health. And it's the entire thought process. Looking at the brain changes everything. Getting in a good brain rehabilitation program is monumental. So if we can reframe our society and start focusing on the health of the brain, doing the things you need to do naturally to keep the brains healthy, and sometimes medically too, we'll begin the path of ending mental illness. So that is briefly in a nutshell all that I'm going to share with you guys today. So thank you.
Wow, Nadine, thank you so much. You know, yesterday, Giovanni and I were having a conversation, and we started the conversation with this, that the barrier, like the #1 barrier to high performance in life and in business, is guilt and shame. And what I'm discovering in this conversation is that when it comes to curing mental illness and doing something about it, could it be that the #1 barrier is what you're pointing to? Like without a brain scan to point to the objective source of the illness, all we, the parents of young men like your son, all we, the friends of people with PTSD, all we have left is the guilt and shame associated with the condition. And that guilt and shame doesn't even give us the opening to go get a brain scan. So thank you for introducing the world to brain health as the beginning of the end of mental health. And I think like a real boon for people to rid themselves and their loved ones with the guilt and shame associated with mental illness. What if I could treat my mental illness just like I treat a cold?
Exactly.
Nadine, thank you.
Exactly.
Thank you. Molly had a question. Molly, go ahead.
Um, I have TBI myself, and I've heard of hyperbaric chambers, but how do those help?
So a hyperbaric oxygen chamber, and you can certainly read more on our website about it at hopedealersworldwide.com. But hyperbaric oxygen chambers use ambient oxygen. We do mild hyperbaric oxygen. I have the same one over here that LeBron James is in. It's way the top of the line one here. And it forces oxygen to pressurize and forces it into parts of your body that normally don't get oxygen. So when you have TBI, you're going to get oxygen forced in those areas to now get some blood stimulation going. It works really well with people just recovering from sports injuries or recovering just from surgery. Just gets more oxygen forced in that area. and that heals.
All right. Also, do you do talks with your company, like speaking engagements?
I do.
You
Yes.
do. Well, I own a nonprofit. It's called A Second Later, and it's about distracted driving. I don't know if you would be willing to talk with me.
I would be happy to speak with you at any time. My contact information, you can find at hopedealersworldwide.org or hopedealersworldwide.com.
All right, thanks.
My pleasure.
Giovanni,
Thank you,
I
Molly.
don't know if a brain scan will help the morning jokes, but you know, there is hope for us.
Thank you, Sorrel. Thank you, Molly. And thank you, Nadine, for, there is a plethora of things that I want to thank you for, or at least acknowledge you for. Your journey is fascinating on being in a particular life journey, and then taking in some degree a new journey with your son, and then taking them to Guatemala and taking the whole group to give them a new compass, a new north for the opportunity that their life can be. And it's fascinating what you say, that all of them with the community, right? The community is critical, are now out of the structures that they had before that kept them dealing with the struggle, right? I struggled with addiction, my whole life in some degree or another, with a little bit of drugs here, a little bit of alcohol there, but always there. And then finally, when I was able to leave it all behind, was when I just went all into cigarettes, so that I smoked like a chimney, and then I needed to stop it. So it was just unbearable to be around me, because I smell like an ashtray. So I went into sugar, and then I love my sugar. So now I'm going veggie now, and I'm kind of finding the balance now finally with going veggie, thanks to Andrea and the sexiest man alive, Vince. And I'm finding the balance. But anyway, I don't know why I went into sharing this with you. The point that I'm trying to say is, I really want to thank you for doing all of the work that you have done to be able to show what you did today. And I can't wait to get your book. Congratulations on being the #2 next to Michelle Obama. I mean, that's not a small thing.
Excuse me, I was #1. Michelle Obama was #2.
Excuse me. I'm just going to get this right. No, even that, I mean, it's just such a remarkable, in the world of an accomplishment, right? It doesn't mean anything unless I read the book, but in the world of an accomplishment, well, really well done. Really well done. And just really admiring who you are. Thank you for being in the Daily Huddle family.
Thank you.
What I want to ask you, Nadine, just real quick, I'm going to ask you something, and then then I'm just going to ask you something real quick, Nadine.
Sure. I just had to show you this, though. I was 1. Michelle Obama was 2.
I got it. You have to show me. No, no problem, Nadine. No problem. So, and don't worry, I'm gonna brag around. I'm gonna go around my friends bragging around that I know the #1 best-selling above the person above Michelle Obama. I'm gonna keep bragging, right? And she was at the Daily Huddle, by the way. Anyway,
Wow. That's great.
No, I'm talking about you, Nadine.
Oh.
I'm talking about you. Yeah, I'm going to brag about you.
You guys said we keep it light and funny, so that.
No, I love it. Here's what's my question, real quick. My question. So, at some point, someone referred me to taking certain pills to balance my brain. It was the worst advice I ever got in my whole entire life. Who I became out of that process was just unknowable to myself, given that I had the training I had to understand self-awareness. I was able to see the path I was going. Like, really, it was just the worst advice. Now, it doesn't mean what my experience with it is a general experience. you know, it was my experience, like, no, I'm going to deal with meditation and self-awareness, given that the way I was numbing my life wasn't working. But I like to maybe get someone from you who knows a little bit about the whole topic. How do you, you know, the mental illness is in some degrees being addressed a lot through the pharmaceutical industry. Take this pill, balance it out. What are your thoughts on all of that?
Well, first of all, you got to consult with the doctor. Now, the doctors that I partner with at Amen Clinic, we partner with them. I do the counseling and the accountability, and they are the ones that say, here's a medicine pharmaceutical route, or here's a nutraceutical route. What's your choice? Which one do you want to do? Because if you don't do one, you're going to be in worse shape than ever. So you got to choose whichever one works for you. So if you want to take the nutraceutical route, I have the doctors, you know, recommend what's great. And I've learned a lot from them about that, but I would, you got to get cleared with your doctor first with the whole medicinal nutraceutical thing, if that makes any sense.
Yeah, balancing it out. You know, I had to fly to Colombia for work at one point. And I met a very authentic doctor who said, I don't want to prescribe you anything because we may lose you, but I don't want to not prescribe it because we may lose you too. So what is you got to look at how much power do you have over your brain, he said. And so it was kind of a balance. I chose not to, given that I hated the experience of numbing myself. But yeah, I get it. There's a balance aspect to mental health. And anyway, no more to say, Sorel. Anything else you want to add, Sorel? I know I kind of went at it. I'm kind of passionate about the conversation. Go ahead, Sorel.
Oh, no, this is exactly what the Daily Huddle is for. And digging the passion out and spreading the hope with contributors like Nadine. Any other questions or comments or any yabats from the audience?
As we wrap up, Sorel.
Yep.
Well, one thing I was going to mention to further answer your question, Giovanni, if I have a client that's struggling with anxiety, it's not going to hurt to try a nutraceutical, and there's all different kinds you can get, but lots of times in the basal ganglia system of the brain, which we saw in the picture, if someone has anxiety, there's a lot of activity going on in that system. And there could be a depletion in a neurotransmitter called gamma aminobutyric acid. We call it GABA. So you can go on Amazon, you could go get a good quality GABA from Amen Clinics, whatever is your choice. And sometimes supplementing GABA will truly help the situation. If you want to know if that's the situation for sure, get your brain scanned. If you want to take a guess, you're not going to hurt yourself taking a nutraceutical, and see if that does the trick. So there are different things that we know that we can try that are harmless that may replace.
That is so true. So true. I remember having that conversation with a certified physician, right? And I said, well, I don't want to take the pill. Where else can I get the GABA? And she said, well, you could get it through beer. So you might get into alcohol then. I was like, no, I'll take the pill. Anyway, this reminded me of that. That was so great. So true.
Love it, love it, love it. Nadine, your participation today has been enlightening, invigorating, and certainly injected a level of hope throughout our family, and I dare say the world. So your last comment for this session, what would you say to us as another injection of hope?
I would say that if we together as society can reframe our thinking and perspective on mental health, if we could no longer view this as mental illness and reframe it with how can we achieve greater brain health, then if we could have that revolution, it would change the stigma and the whole guilt and shame thing, the entire mental illness. It would be the beginning of the end of mental illness.
Well, thank you for assisting us in taking that first step And the very next action is for me, by the power vested in me, to dub each and every one of you listening to this hope dealers. Go forth and conquer. Giovanni, there are 5 ways. I'll say the 5 ways, but I'd love for you to say the benefits of actually practicing those.
Yes. Nadine, thank you so much for being here. And everyone else, thank you for being here. We'll see you tomorrow. And remember, there is 5 ways. There are 5 ways for you to be sexy for the rest of your life, live a long life, have an amazing skin and an incredible body. And Sorrel, tell us.
If you don't believe us, do like Nadine say, go try it. I mean, how will you know unless you look? Love always is the number 1. Laugh out loud. Eat more plant-based. Stress less and shake what your mama gave you. Move like crazy.